Hi, I'm Charlie Colegate, and today I'll be presenting insights from the work that I've completed over the first year of my PhD. So, in parallel to conducting a literature review and speaking with professional stakeholders, I spoke informally with 13 women with lived experience of perinatal mental health conditions. Now, although NIHR require their researchers to conduct patient and public involvement activities, I did this not because of an NIHR mandate, but because I believe that research should be grounded in the needs and priorities of those who are most affected by whatever condition or phenomenon we as researchers have an interest in studying. Briefly, just for some context, I want to highlight key findings that emerged from the literature review. So, first, despite there being recent large investments to improve patchy provision in perinatal mental health care for women with severe or complex mental health conditions, for women living in poverty or women from particular minoritised ethnic groups, they still experience significant inequalities regarding access to care. More conceptually, stigma was talked about extensively in the literature, but in very taken for granted ways. So, by this I mean the concept of stigma was rarely defined or critiqued, despite it being a strong feature of women's experiences of illness, and despite it being often positioned as a reason behind inequalities in access to services. Another feature of the literature is many papers recommended that women at most risk of severe mental illness be identified early, and that perinatal mental health care should provide preventative as well as restorative care. And this was often suggested without critical reflection on what it means to identify and treat risk instead of illness, and without critical reflection on understanding what the implications are for women of being identified as high risk and the implications of this specifically for those who experience health inequalities. From an equity and inclusion perspective, qualitative studies exploring women's experiences don't widely include the women who we know are at risk of the poorest outcomes and the ones who aren't getting access to quality care. In parallel to conducting the literature review, as part of my PPI plans, I spoke informally with 13 women with lived experience of perinatal mental illness. So I made contact with women and shared with them an accessible summary of my draft research plans. And I decided to speak to them one-to-one because I thought that this was more inclusive than running a single workshop, particularly for those who might be doing shift work or having care and responsibilities. So we spoke either via video call, phone call, or via email. From an equity perspective, it was important to me that I speak to women who had experienced different forms of mental illness, as well as women from different socioeconomic and different ethnic backgrounds. And funds in my award meant that I was able to provide women with a small token of thanks for their time. Now, literature on the practicalities of involvement really underlines the importance of keeping people informed of progress. So after I'd got ethical approval, I sent a written update sharing what other women had said was important to them and various changes that I'd made, and women really appreciated this. So women were incredibly generous with their perspectives, and I wanted to share with you now a little of what these conversations revealed. So this slide shows things that were really important to women, which they thought could be better understood in relation to perinatal mental illness. I just wanted to put these side by side with the areas for future research which was suggested in the most recent review on the field. And I think this highlights the inherent tensions in how researcher priorities and women's priorities sometimes align and sometimes they don't. So women challenged many assumptions and lots of things in the project changed as a result, but I want to focus on some methodological implications. So this area of research is highly sensitive and the project itself involves interviewing participants who may be perceived as potentially vulnerable. So literature around feminist approaches to research indicates that incorporating creative elements into interviewing practice can be a powerful way to enable the discussion of difficult or painful subjects. It can be a great way of building trust and rapport and can also be empowering for participants as they can set the direction of the interview and foreground things that are really important to them. And it's for these reasons that I thought they'd be really useful in this study. So related to this, so qualitative literature indicated how isolated women often feel during recovery from severe postnatal mental illness. and how often peer support can be really helpful in addressing this. So, knowing there are other mums who've been through what they've been through. And this led me to consider whether focus groups could be an empowering method to use. So, one which could connect women to others, to enable them to hear others women's stories and to place theirs in dialogue with these other stories too. So during our conversations, women really challenged these assumptions that I'd made regarding what research design decisions may and may not be appropriate. So we discussed what they would and wouldn't be comfortable with if they were participants in the study. So regarding focus groups, many said that they'd actually be really reluctant to share their truth of their experiences in such an open space with strangers out of fear of judgment. And some said that they wouldn't even respond to the call for participants at all if they knew that a group interview method was being used. So I also asked women what they thought about being asked to bring along photographs and drawings or small objects to the interview so that they were able to start the interview off in any way that they wanted. So many women, they like the idea of being in control of where to begin, but they weren't too keen on bringing something along with them. So some said that it'd be hard to find the time to think about what to bring alongside caring for their children. Some said that they'd find it really stressful thinking about what the right thing to bring would be, despite being told there would be, no right or wrong answer in terms of what to bring. But some women said that it could also be quite a painful process too, deciding what to bring. So with these insights, I really did have to approach the research design. So I'll still be using focus groups for interviewing professionals, but I've instead selected a method of interviewing which would still allow women the control to start their stories wherever they wanted, but won't incorporate any of the creative elicitation techniques. So alongside the research study, I've planned a parallel stream of activity, which will mean working closely with women throughout the project. So as well as sending regular updates, I'll be testing preliminary findings and theories with women, and they'll have input into the topic guide for the focus groups with professionals. And I'll also collaborate with them towards the end of the project to create dissemination materials for women, for other women, materials for health professionals, and also for voluntary sector organisations to make sure that the knowledge generated really has impact. So if you'd like to find out any more about taking part in the study, or you'd like to get in touch, then please do. I just want to conclude by thanking the women who spoke with me and who were so generous with their time and their perspectives, and to also thank you for listening and encourage you to, please get in touch if you want to know more about this work or to share any insights from your own work in this area. Thank you.